How can health workers fighting the coronavirus pandemic be better protected? Doctors and nurses around the world are risking their lives to treat the growing number of patients. Can the enormous mental and physical strain on them be reduced? This is Inside Story. Hello and welcome to the program. I'm Mohammed Jamjoom. The war against the coronavirus pandemic is being fought in hospitals around the world. Doctors and nurses are on the front line. But the long hours and huge workload are taking their toll. Hospitals are not only running out of ventilators for patients, they can't supply staff with protective gear such as masks and surgical gowns. Thousands of health workers are falling ill. The number who've died is growing. In Spain, medical staff account for 15% of reported cases. And health workers in Britain and the U.S. say they can't get tested for the disease because there aren't enough screening kits. Some medical staff have even been attacked. In India, police had to rescue doctors from crowds throwing stones. Many health workers have been sharing their experiences online.
We're running out of equipment in the hospital. Nearly everybody coming to the emergency department has this, and we're getting completely overwhelmed.
The one that's beeping in the background is a young patient who was presumably healthy before they came in. This is not something that's isolated to the old. Please hear this warning and do whatever necessary to prevent this from spreading.
¿Qué está pasando en Madrid?
What is happening in Madrid? We are completely overflowed. Health workers are exhausted, physically and emotionally, because this is awful. This is an inferno.
I'm a critical care nurse. I've just finished 48 hours of work. I just wanted to get some stuff in for the next 48 hours. There's no fruit, there's no vegetables. I just don't know how I'm supposed to stay healthy. And there's people are just stripping the shelves of basic foods. You just need to stop it. Because there's people like me that are going to be looking after you when you're at your lowest. Just stop it, please.
All right, let's bring in our panel. From the U.S. Capitol, Dr. Jehan El-Bayoumi is professor of medicine and founding director of the Rodham Institute at the George Washington School of Medicine and Health Sciences. And from Hong Kong, Paul Yip, chair professor at the Department of Social Work and Social Administration, University of Hong Kong. Welcome to you all. Jehan, let me start with you. Just how vulnerable to infection are health workers on the front lines right now?
Extremely vulnerable. As you can imagine, physicians, nurses, social workers, even the people that mop the floors and deliver the food are extremely vulnerable. Depending on what procedures they're doing, then their risk goes even higher. So you can imagine when you have a critically ill patient that needs to go on a respirator, the act of actually putting the tube down the throat aerosolizes all those particles, those droplets that are filled with virus and can scatter and really make people extremely vulnerable. And actually, if you notice in Italy, in France, in Spain, in China, as well as in the United States, there have been many people on the front lines that have unfortunately succumbed to COVID-19.
Paul, could you talk more about some of the other challenges facing medical workers right now around the world?
Well, I think it is the overwork, I think, in the social, in a hospital setting. And also, I think now they do not allow the visitors, I think, to come in to look after to visit the patients now. It also creates additional workload, I think, for the health workers. And also now we are running out of masks and also the protective gears, which also expose, I think, our medical and health workers, I think, to the COVID-19.
Jehan, things are so bad now in some parts of the world that medical workers are actually having to create and having to make some of their own protective gear, right?
That's correct. I was talking to a dear friend who's an infectious disease physician up in New York, which, as you know, is the sort of epicenter and hotspot here in the United States. She is actually using a garbage bag to protect herself. She wipes it down with bleach in between patients. She's used the same mask for the past week and finally had to throw it out. So yes, people are making do, but it is really, really an untenable situation and increases the risk to everybody, but primarily the clinicians and the healthcare workers that are providing the much needed care and critical care for patients who are really suffering. And also don't forget that the clinicians and the other rest of the team are usually the only contacts with the patients, right? Families can't go visit, loved ones can't go visit. So you can imagine that a patient who is there, probably disoriented from all the medications that we're giving them to just stay sedated on the respirator, and then you've got somebody with a mask and a garbage bag. I mean, how horrible is that? You can only imagine.
Paul, what are some of the ethical dilemmas that medical workers are confronting now due to the healthcare systems around the world being so stretched?
Well, I think they are exposed to this excessive stress. I mean, as what I have said before, I think there's an isolation. I think there's a fear and panic among the patient themselves, not only affecting the physical health and also their mental health as well. So I think now these healthcare workers, now they not only have to provide the support and care, I think for the medical, for their physical health, but at the same time, I think they have to pay attention, I think, to the mental health, I think, of the patients. So I think that is really doubling the workload, and because the visitors can go in and can provide some sort of support, I think, to the patient as well.
Jehan, let me ask you the same question, because we're hearing more and more about really just very difficult ethical choices that medical professionals are having to face now or may have to face soon. Could you elaborate on that?
Sure. I mean, in normal times, not during the pandemic, we face ethical dilemmas all the time, and we take care of people that are perhaps elderly or terminal, and we have to have very difficult decisions and discussions with their family members. You multiply that by a million, if not a billion, and when equipment is limited, when we don't have treatments, it becomes sort of this decision of, is there going to be a possibility that this individual patient is going to recover, right? And if they're older, above 80 in particular, if they have chronic medical conditions, which there are numerous ones, which I'm not going to list because I think it would take the rest of the program to list them, and the wishes of the individual patient too, if we have that access, a living will, or if there's a family member, a durable power of attorney to say, look, if I'm ever in this situation, I do not want to continue. And a lot of our older patients, we try to encourage them. It's actually a Medicare requirement that we ask about that in general, in normal sort of times. So the ethics of this are complex, but I want to talk about another aspect where ethics are involved, but sort of outside of the hospital. You know, when we talk about health disparities, which is what the Rodham Institute does and is dedicated to, when you think about lack of food, lack of housing, lack of transportation, lack of education, that's actually what makes people much more vulnerable to illness and to catching COVID-19. And so, for example, in Washington, D.C., 50% of the people in the poor wards, Ward 7 and 8, up to 50% have diabetes. That is a significant risk factor. So when you look at the deaths in the patients and people in the communities, the people who are living in the poorest communities where their baseline health status is poor are at particular risk.
Paul, you wrote an article where you said we need to ensure we are well prepared for what lies ahead. That means staying healthy and getting lots of rest while looking out for each other. I want to ask you if that is possible right now for medical professionals, given the enormity of this crisis.
Well, yes, I think it is difficult. But I think, but what else can you do? I think what we need to do, I think we try to stay optimistic. We try to have sufficient rest. And I think, and everybody, I think, try to stay away to get contract of the diseases and not to overload, I think, the hospital system again. So I think what I really can say is that at this moment, I think everyone have to come together. I think, yes, I think the medical health worker, they do have their job to do. But I think for the ordinary citizen, I think we also have to stay well and stay healthy and not to contract the diseases. And then otherwise, I think it will just create additional work, I think, to the already overstretched the hospital health workers.
All right, let's look for a moment at another aspect of this. Photos circulating online give us a glimpse of what daily life looks like for those health workers that we've been speaking about. Many of them posted selfies showing the toll the fight against the virus is having on them. Probably the most striking images are of their faces. These bruises are caused by wearing protective masks for hours. A photo of an exhausted nurse in Italy slumped over her keyboard also went viral. And emotional pictures of staff reaching the breaking point or being comforted by their colleagues are also being shared. Health workers are discouraging non-essential visitors to hospitals to ease the pressure by staying at home. Jehan, let me ask you about this. Seeing this, these staggering pictures, photos that are circulating online of just how exhausted and traumatized these medical workers are, is this having an impact?
Of course it is. I mean, just think of yourself as a human being. Any parent who's ever taken care of a newborn baby or faced any adversity themselves, I mean, when you're not sleeping, and I think for clinicians in particular, you know, we like to make sure that people are taken care of, to alleviate suffering, to cure people when we can, but always to provide compassionate care. And that's not something that we have control over, right? Add to that the added aspect or burden of worrying about your personal health. You know, I'm of the generation where I took care of people on the front lines during the AIDS epidemic. And there are similarities and differences. At that time, it was 100% one-year death rate. Of course, the rapidity among certain groups in terms of infection was quite high. However, what you're seeing is still the fear of actually contracting HIV was there, but through bloodborne products and so forth, but not through obviously aerosolized. And this is a highly contagious infection. I have a colleague, a medical assistant, who is concerned about giving care because she is the primary caretaker for her 73-year-old mother and her 93-year-old grandmother. And I asked her, well, isn't there anybody else that can help you in the extended family? She's like, no, there isn't. I'm it. So imagine the physical toll that's visible, but as Dr. Paul mentioned, the mental health toll that is not visible, that I think is just as important. You're also adding sleep deprivation. I can tell you when I was working 120 hours a week during my internship, we're not eating that well either. Then we know that just our ability to stay focused and sharp when we haven't slept is amazing. I mean, it's very, very challenging. In addition, you're worried about your kids, if you have any, your family. I mean, I have older parents. I'm not able to see them. I mean, the burdens are many. So imagine that everybody else is worried about COVID-19. And of course, community members and the general population is already stressed and worried, but add all of these burdens and you can only imagine how stressful and difficult it is.
Paul, since we're talking about stress, since we're talking about the enormous toll that this is taking on health workers across the world, from your vantage point, could this lead to long-term post-traumatic stress disorder and other problems for healthcare workers?
Well, indeed, I think if in Hong Kong, I think in 2003, we have the SARS epidemics. At that time, I think we have 2,000 cases and 300 deaths. But what happened, I think during that year, we have the historical high number of suicide, I think, in the community, and especially among, I think, the older adults. I think why they kill themselves, I think when we read the death notes, I think it suggested it is the isolation, it is the fear, it's the anxiety arising from the epidemics. So I think what we can see is if we can learn something from SARS, I think what we better to do, I think, to deal with the COVID-19 is really trying to how to make sure to contain our fear and anxiety, and make sure that even in the isolation, I mean, how can we still help to connect these disconnected people, I think, in order to maintain their mental wellness.
All right, so we're joined now by a third guest from Italy. Marco Giacchetti is president of the Policlinico hospital in Milan. Marco, let me ask you first and foremost, just how bad are things there right now for healthcare workers?
Yeah, good afternoon, everybody. The situation for the workers now, it's really hard. It's really suffering because they are under real great pressure. And at the moment, luckily, we hope it will last like this. The tension and the pressure is a bit lightened, but still very strong, because we are access to emergency. It's a bit we are fewer person accessing emergency now at the moment, but we hope it will last now for the future. But we had really bad time in the last days and weeks.
Marco, I was in Italy reporting from Milan in late February, and we were speaking to health workers there who were really worried that it could get much worse. What are the conditions there? What's the reason that it has gotten, or the reasons that it has gotten as bad as it has gotten?
I think we have been, after China, the front line, the first one to face this virus, and I think we will not understood very well how heavy and how difficult this will be, and so maybe we reacted not as the same energy we understood we needed after a couple of weeks. So I think at the beginning we thought it was something very easy to control. Instead, it spread it around very quick and fast, and so we were not prepared at the beginning. Now, after the first 2 weeks, the first 10 days, we have taken the measure, and we have, I think, all the best cognition how to react and how to put us in front of this.
Jehan, you've been speaking a lot about the impact all of this is having on family members of patients. I want to ask you more specifically about family members of health workers. I mean, how difficult is it for doctors and nurses and other medical professionals who are grappling with the idea not just that they are vulnerable to infection, but that they could also be infectious to their loved one, especially their spouses and their children?
Well, that's the whole concern. I mean, what is most important to people in general than your family and your loved ones? So that is a real issue. I can tell you, when I start working in the hospital, I'm going to stay in a hotel just to minimize my contact with family members. I know that other clinicians who can afford to are doing the same, and you know that further kind of worsens the isolation. I mean, we are social animals. How we've evolved is to connect with each other. And actually, scientifically speaking, when we connect and when we interact, just the mere fact that we're interacting increases the dopamine levels that bathe our brains. And those are the sort of the feel-good neurohormones that circulate. And so being isolated and not being able to hug, I mean, this business of not touching is really deprivation. I mean, that is deprivation for a parent who has a child, especially an infant, and to not be able to hold that infant, that can have some longer lasting impacts. But I think, you know, one of the positive aspects, if you will, of all this, I cannot tell you how many of my patients have reached out and said, look, we're thinking about you, we love you, please stay safe and healthy. I think what's different about this pandemic is the connection between people overall with each other and the clinicians. I mean, now in New York City, every day at 7 o'clock, people just applaud. They go out and around their balconies and applaud. the healthcare workers. And I think that that's different, and it really speaks to community resilience, because we have to look at this as a marathon, right? And we have to see ourselves as being connected. You asked a really important question about why Italy, why the United States, why we're kind of behind the eight ball. Well, this underscores the importance of public health, preventative health, as well as high technology, of working interprofessionally, whether it's social workers, clinicians, nurses, doctors, looking at the social determinants of health, such as food, housing, etc.
Marco, let me ask you on a more personal note, how concerned are you? How concerned is your family for you? And what are the kinds of things you're hearing from colleagues working in the healthcare profession there?
Yes, we are very worried, and I completely agree with the intervention made before, because there's really tough for operators and for patients to face this, something new, something different, and something so strong and dramatic. And so the worrying, it's completely scaling up. And I think the socialization, when this will finish, I hope it will finish, will be really hard to reach again. And I noticed that everywhere we react in the same way, applauses from balcony to physicians and nurses, to the health people, and that's finally it's something that we recognize how useful and how important is to reinforce the public health system, because we have persons like our nurses, our physicians that are not going home since weeks, and we are trying to support them with a special service made by our psychologists and psychiatric. We made it as soon as possible to relieve them, because it's really hard for them not to go home and not to see the loved one. And as well for patient, we use tablet to make them communicate with the family. That's very important as well, the way they can react to recover as sooner.
Marco, we don't have a whole lot of time left, but let me just ask you, are you starting to get a sense that the government of Italy is going to be providing you with more of the equipment and gear that you need? Is there any light at the end of this tunnel right now?
Yeah, that's a great point, because the lack of protection, the mask, because all the world is looking for that, and with the globalization, we moved the production in just one place. No one country produced their own masks. They so not, because we delocate everything in China especially, and so now lots of industry are moving to this production here in Italy. And so I hope soon we will have a production and a home production enough to give the protection gear to our people as soon as possible, because it's really a fight as well between a hospital and another, and one government and another, to get the right gear for their own health people. And I think we must collaborate more between the international community to organize better production and distribute them in a better way.
All right, well, we have run out of time, so we're going to have to leave it there. Thanks so much to all our guests, Dr. Jehan El-Bayoumi, Marco Giacchetti, and Paul Yip. And thank you, too, for watching. You can see the program again anytime by visiting our website, aljazeera.com. And for further discussion, go to our Facebook page. That's facebook.com/AJ Inside Story. You can also join the conversation on Twitter. Our handle is @AJ Inside Story. From me, Mohammed Jamjoom, and the whole team here, bye for now.